Today, a 65-year-old female who had a chronic knee pain had visited my clinic. She was walking with a waddling gait, and then she said the pain was there 10 plus years, and whenever she gets more pain, she used to apply that naturopathy oil or Ayurvedic oil, and then she keeps quiet. When the pain is too severe, she used to take some painkiller, and then she was trying to push her life like that. Now at the terminal stage, she came to us. She's asking me, what can be done for the knee pain. We had to do an X-ray now because it's high time. So we did the X-ray. The X-ray is looking like this. You could appreciate bilateral medial joint space narrowing. There's a bone-to-bone contact of the knee joint, especially in the middle joint compartment. There is a grade 3 arthritis. Ideally, this lady needs a surgery. But now this lady is asking me or pleading me how to avoid surgery. I want to remain painless without the surgery. All I ask from these patients, why you didn't meet us when the pain was in the minimal stage? Why you didn't meet us when the condition was in the beginning stage? When you got your first knee pain in your life, you could have met us. We could have identified it as an early stage of osteoarthritis. We would have advised you to do certain exercises, certain load management strategies, the knee angle correction exercises, and the nutritional advices, and right biomechanical way of doing the activities in the house and in the office, so that you could have definitely avoided worsening to this state. Now people, they all wait and watch, and then they meet the doctor at the terminal stage, and if the doctor could not help them, they say the doctor is useless. Okay. And most problem are waited for a long time before even it is getting diagnosed. The condition would have worsened to the terminal stage. So if you want to prevent the knee replacement surgery, all you have to do is one thing. When the pain is in the beginning stage, get it diagnosed, then do the activity modification, corrective exercises, and then weight loss, and then physical activities management. With that, you can actually prevent the TKRs. We are known for tolerating the pain for ages and wait till the irreversible damage happens. If the patient had met us maybe 10 years back, we could have definitely avoided the surgery. If you go for surgery, the surgical outcomes are also 50-50. So it's better to not to let your body to go to the terminal stage. Meet a right physiotherapist, address the pain when the pain is in the earlier stages, so that you can avoid the future suffering, future disability, and even future pain. Okay.